There are levels of validation because there are emotions underneath emotions like that layer you're talking about.
Well, I'm real curious about this idea of shame. It's been brought up in the years that we've been talking, and maybe we need to just really focus on this shame idea because that seems to underlie so many things. Well, I also think there's some shame in those kind of things too, and I'm speculating, right? But the idea of shame going across all of these mental disorders and mental issues that we've been dealing with, but shame has got to be, a good therapist would probably sort that out very early on to get to the sources of shame and the incidents and the
Yeah,
history.
we sort of talked about how that a basic therapeutic technique is validation. So you sort of validate the feelings someone's having.
Yeah.
But there are levels of validation because there are emotions underneath emotions like that layer you're talking about. So there are first level validations, second level validations, and they move closer to what's often referred to as a clarification, an emotion that is yet to have been bidden. And you're able to say, wow, I sound like I hear really angry, but man, I think I can also hear some real loneliness in that. And then suddenly, when someone is able to move to that, there's the possibility of getting to the center of that and to be able to say, yeah, I often, when I feel my angriest, is because I feel left out. And so I hate the world that has rejected me. And so suddenly there's, being able to have that, be able to name it for what it is, then gives you a chance to possibly do something with it.
And the idea that shame is a basis for a lot of things because it has been central throughout your development, or if you haven't worked on it, it just seems like that's one that particular issue is going to take a long time, and it's really going to be in-depth therapy to kind of get at that. First of all, to be able to have the client talk about it and put it on the table, and then have that dialogue and do the work that needs to be done. That's got to be an investment in therapy and
Mhm.
work that just skim over.